Good evening. Thank you so much for joining us. We will wait just a minute or so for folks to trickle in and then we'll get started. We have a hour-long webinar for you tonight for midwifery and maternal-child health systems. All right, let's go ahead and get started. Welcome. Thank you so much for joining us tonight at Bastyr. Happy to have you joining us for this hour-long presentation on our Masters of Midwifery and Maternal-Child Health Systems. I'm joined by our amazing department chairs and faculty, as well as admissions staff. So we'll start by going through the midwifery program, and then we'll lead into maternal-child health. Um, all the outcomes, curriculum, prerequisites for those programs. And then we'll launch into some admissions information, the application process, how that's going to work. If you have some questions along the way, feel free to drop those into either the chat or the Q&A section, and then we'll either answer those in the moment or at the end, depending on when that's appropriate. So I would like to turn it on over to Paula and Maya Johnson, the leads of our Masters in Midwifery program. Thanks so much for being here.
Hi, everyone. I'll go ahead and jump in and start. My name is Dr. Paula Pelletier Butler. I am the department chair of both the MS in Midwifery program and the MA in Maternal-Child Health Systems program as well. I have been a midwife for almost 15 years. I am a proud graduate of this program, first starting out with Seattle Midwifery School and then moving into Bastyr. In 2019, I was among the first group of midwives in the U.S. to earn a doctorate in midwifery from Thomas Jefferson University. That's what the DM stands for next to my name, in case you might be wondering. I'm also an associate professor with the department as well. I'm a licensed midwife, or LM, and certified professional midwife, or CPM. So those are the letters past our names. And I practice currently part-time in a small community home birth practice. Before I became a midwife, I was a nurse and body worker, and I've been a healthcare educator nationally and internationally for almost 30 years. So I'm excited to be here and share more about our program. And Maya's next.
Hello, everyone. My name is Maya Johnson. I am the program director from the midwifery, specifically midwifery program, also core faculty. My graduation was originally from Brazil, actually. That's where I graduated as a midwife, but I am also a graduate from the Maternal-Child Health Systems program here at Bastyr University. And currently, my main gig is to be here with you, but I still attend families and I do postpartum home visits and eventually going to births. But still, in the busy world of midwifery, we're always a little bit involved. Okay, Kristen is next.
Hello there. I'm Kristen Eflin. I live in the middle of Washington State. I was a midwife in medically underserved areas for 9 years. I now teach full-time in both programs, actually. So, but also the director of the Maternal-Child Health Systems program. I was one of the first in the first year of graduates as well from the program because I knew I wanted to teach. So very excited to still be here. One of my big areas of passion is health policy. So I, very much enjoy working with the Midwives Association of Washington State in that capacity and others.
Thanks, Kristen. Carrie.
Hi, I'm Carrie Scully. I'm one of the admissions advisors here. I look forward to working with you. Thanks for coming. I also wanted to invite you to come to campus. So I give tours on Thursdays at 11 o'clock. So you can register online for a time that works for you, and we can tour the campus. So I look forward to seeing you there.
Thank you. And my name is Mark Thompson. I'm the director of admissions. I am the lucky one who gets to work with this amazing team, and I look forward to meeting each of you all as you begin your journey with us.
And just there's one more person, Heather Sullivan, that was not listed there. And Heather, do you want to introduce yourself as
Oh,
well?
hi, Heather.
Sure. I'm a little add-on. I'm Heather Sullivan. I live in Portland, Oregon, and I am a midwife there. But I'm also the clinical education supervisor for Bastyr. I'm actually on Bastyr campus right now because I'm the instructor for Intro to Practicum and then a clinical seminar class where it's focused on the clinical part of the training in the midwifery department.
Thanks, Heather.
All right. Well, let's jump into why we do what we do. The maternity care system in the US is in crisis. 1 in 3 childbearing people today give birth by cesarean. This rate is twice the rate of that of the World Health Organization recommends. Our C-section rate hasn't changed much over the last 15 years, despite multiple efforts by a variety of organizations, including obstetric organizations, to try to bring that number down. Families of color, in particular, experience worse outcomes on all measures, especially Black and Native American families. Rates of preterm birth, infant mortality, maternal mortality, all of these are multiple times higher for Black and Indigenous families in the US. In New York City, Black maternal mortality is 12 times higher than for white birth givers. So it's clear that the system is failing certain members of our large community, our American community, most notably Black families and Indigenous families and people of color. Birth can and should, for us anyway, be a life-changing event, but mistreatment and disrespect during childbirth is widespread. These are all symptoms of a maternal-child health system that has not changed appropriately to meet the needs of the population, a system that overuses technology to compensate for its inability to provide human-to-human care. Overuse of technology can actually create worse outcomes in much the same way that underuse of technology can. All right, next slide. But here we are, and we feel we have a better way. There is a better way. Bastyr's Department of Midwifery has clinical and leadership programs that focus on wellness during the childbearing year, within the all encompassed within the midwifery model of care. The system has to change, and not in sort of a Band-Aid sort of way. And the midwifery model of care has been shown to improve outcomes in many other high-resource countries. We offer a 3-year Master of Science in Midwifery and a 1-year Master of Arts in Maternal-Child Health Systems. Both of our programs focus on building leadership within a midwifery framework and a social justice framework, because these inequities cannot stand. Centering the health and well-being of Black, Indigenous, and people of color in the healthcare system must be a priority. And we know from decades of research and practice that when these communities are centered, health outcomes improve for everyone. All right, next slide. Midwifery care makes a difference. Our graduates are equipped with the skills to reduce cesarean rates, improve not only individual health, but community health, and restore optimal maternal and infant outcomes on the family's terms. The midwifery model of care rests on the fact that each individual is the best decision maker for themselves and their family. The patriarchal, quote, "I know what's best for you" model of US healthcare has not worked. In our model of care, individuals are given lots of information about various tests and procedures during pregnancy, given the time and space to ask questions and receive all the answers. And if we can't find them, or if we don't know them, we will find them. And then they are supported to make decisions that are right for them. We recognize that not everyone should or want to give birth at home or in a freestanding birth center, so this model must be incorporated within the hospital systems of care as well. But individualized care makes a difference. Understanding social determinants of health make a difference, and we believe that you can make that difference too. All right, next slide. At Bastyr and the Department of Midwifery, we seek to transform the health and well-being of the human community. In our programs in the Department of Midwifery, we do this through the art and science of midwifery, through humility, and through leadership. We expect all of our graduates to be leaders, and we have a long legacy of leadership in our professions. The healthcare system, as it currently stands, is not transforming health and well-being in a positive and generative way, and this begins with birth. There is little more transformative than giving birth. And we know how this could be for everyone. All families deserve this kind of care, the kind of care that results in a transformative birth experience that transfers into their everyday life. Next slide. And I think, Maya, are you taking over here?
Yeah.
All right.
So what is this care? What is the midwifery model of care? So the midwifery model of care rests on several principles that can be applied in any birth setting. So we believe that pregnancy and birth are a normal life process. We minimize the use of technological interventions, recognizing that sometimes they are truly needed. We believe that midwives are experts in the care of people with low risk, healthy pregnancies. We monitor the well being of the whole person, physical, physiological, and social. We believe in continuity of care. You should know who the provider is and will be with you during your whole care, labor, and birth. And we know that birth can occur safely in the home and freestanding birth center settings for people with low risk pregnancies. We are trained to recognize complications and transfer to the settings when more interventions are needed. And then, how can you make a difference? What does that mean to you? Midwifery is a soul calling for many people. If you can imagine not doing this work, you're in the right place. If you're committed to changing the system so that it works better for all childbearing year families, we share your commitment. If you're ready to be a leader in midwifery and maternal child health systems, we can help you to reach your goals. It's going to take all of us, so let's do it. So what does it look like in our program? Let's start with a quick overview. We have a 3-year program with an undergraduate entry option, meaning you don't have to have a bachelor's degree to start. I believe Carrie will talk more about that stuff. We have a blended learning model, which means a hybrid program in that we have online time and then face-to-face, what we call on-site. Usually we have 3 to 4 weeks that are online work, interacting with your instructor, but also we come together at on-site for discussion, what we learn with the materials, guest speakers, taking your exams, case reviews, which means that it's very important for you to be on site, and those are required, it's mandatory. The clinical rotations, it starts in the spring quarter of year one. So that it may be a little different from other midwifery programs that you've may consider. We tried to do as soon as possible so you can have both benefit of the didactic work, but also you're seeing in practice. And I want to hear if Heather wants to add anything to this.
Yeah, I would just say that the first 2 terms of the first year are basically getting you ready to be in clinic and finding a site for you. And then in the spring quarter of the first year, then we facilitate your placement in a clinical site or with an independent practitioner. And then from there on, every term you are doing clinicals at the same time that you're doing your didactic learning.
Thank you. So students in this program can choose between the master's project track, which can be a research project or a capstone project, or the botanical medicine track, which provides a deep dive into the age-old use of herbs to enhance midwifery care. Both tracks provide opportunities for students to deepen their knowledge and skills in the areas that you support their future practice. I also want to mention that regardless of the track you choose, you will still graduate with a Master's of Science in Midwifery. Okay. So this slide shows a little more about how the blend model works. So as you can see in the first year, students are on campus for 4 to 7 days out of every month, and then do assignments and have discussions online for the remainder of the month. In year two, the length of on-site week goes down to 3 to 4 days per month. And in year three, it's only 1 to 2 days per month on campus. The clinical training, otherwise known as practicum, involves working directly with a midwife or a group of midwives who are trained preceptors. Students essentially shadow their preceptors during office visits and at births. Over time, students take on more and more and more of the clinical involvement with the clients themselves, which means you may start checking a blood pressure, talking a little bit in the visit, but then you move towards, checking a cervix, delivering a baby, and guiding most of the talk and the visits as you go to a senior role. Students are always under supervision of their preceptors. Practicum begins in the spring quarter, as I said, of the first year, and then extends all the way through the graduation, so a full 2 years. Students usually spend about a year at one clinical site, then they go to a second site for another year. Heather, do you have anything to add to this?
Yeah, like Maya said, the program is designed so that at first you're on campus more days and you are starting your clinical rotations. And then as you're doing more and more in clinic, you have less and less time on campus so that you have the time for that, especially at the end of your clinical training when you're attending births as a primary under supervision. And then you're also doing continuity of care births, which means you're following a client from their prenatal course all the way through until the birth, labor and birth, and then the postpartum care following that.
Thank you. And I think you're up next.
Okay. So yeah, this is something we talk about the first 2 terms before you start your clinical rotations. We have a course called Intro to Practicum, which is 2 terms. Some of that is clinical compliance tasks, like making sure you understand HIPAA and bloodborne pathogens and kind of clinic health safety. But it's also really talking about and processing what it means to live the lifestyle of a midwife. So we talk a lot about that, how to get yourself ready to be that person, how to get your family and friends to understand that you are going to be a person on call, and to also get ready to interview and find your clinical site or preceptor So preparing resumes, getting ready to do interviews, and just really learning what kind of the day-to-day lifestyle of a midwife might be. It is a very unique thing to just kind of be ready to drop everything and to miss birthdays, even your own birthday, even your kids' birthdays, anniversaries, holidays, because babies come when they come. So we talk about the sustainability of that, about how to take care of yourself, again, how to gather your community resources and your family and your own community to support you in this calling. So it's a lot. It's one of the biggest adjustments. First, your brain is learning all that didactic material, and then the lifestyle is just another piece of really embracing what it means to be a midwife. When you're looking for a clinical site, sometimes there will be opportunities in your own community. We know there's midwives in every community, but to be approved, an approved preceptor for Bastyr, we do have some onboarding requirements and then some experience requirements, training requirements, and then malpractice insurance requirements in order for them to be supervising you and for those births to count toward your graduation requirements. So one of the things we really want folks to understand is you might have many midwives in your community, but they may not meet the requirements that Bastyr has in order to supervise you for this program. What that means is there is a pretty big possibility that you may need to relocate to have a clinical site. Like Maya said, most folks have a year in one site and then finish up with another site. That can look a bunch of different ways. But we do require at least 2 different sites so that you can learn from different practices, and just knowing that there has to be a lot of flexibility and being able to find what's available and who meets the requirements to be a preceptor. So those are things to keep in mind as your ability to do that. It's also depending on what state you're in. There are still many states where licensure is not available for community midwives. So if you are in one of those states, you will not be able to find a preceptor who's approved by Bastyr in that state. So that's something to also keep in mind.
Right. And just if you can, Mark, if you can go back and there's one more thing that maybe we should talk about, which is the online learning. By now, most people have had the experience of learning online through the pandemic, for better or for worse. We have been incorporating aspects of online learning for over 20 years, and this gives our students the flexibility they need while in their clinical practicum. And again, babies don't care if you're in class or not. So you have to work on your management skills and how to prioritize things and work on that time management, because we expect 40 to 50 hours a week of online work. I just want to make sure that we talked about that too. Thank you. All right. So our students have access to university resources such as tutoring and counseling center, financial aid, and many students' clubs. We have a vibrant campus. As you may know, we are in the National Forest Park, located at the tip of Lake Washington. There is also a student village where some of our midwifery students live while they're in the program. All courses are taught by practicing clinicians, over 70% of whom are also officers of nation and state midwifery associations, perinatal health boards, and quality improved collaboratives. Great, thank you. You can just skip. And I just want to talk about the opportunities of, being a midwife all in the world. You can become a home birth midwife, as you may expect that already. You can own a birth center. You can work in specific health centers, such as federally qualified health centers. You can be part of integrated maternity care team. And you can also be further and be working with education or policy making. This is also part of what you can get this master's degree for. Thank you.
Yeah, I'd just like to quickly add that getting that master's degree really does open doors out there. There are a variety of programs out there. This is the only one that offers the MS in midwifery, and those letters pass the name, and that education really does open doors for a variety of different employment opportunities out there.
Thank you, Paula, Maya, Heather. If any attendees have any questions, feel free to drop those in the chat. In the meantime, I will pass things over to Kristen to talk about the maternal-child health program.
All right. Well, I bet you are ready to see some of the faces of our program. Here you see our students, some of them are graduates, and some of our faculty who are really the heart of our master's degree program in maternal-child health systems. The students spend a year putting together incredible projects that impact their communities, and you can see some examples of that from last year on the left. And here on the right are some of our faculty, and some of them were also students in the program themselves. And they really, like I said, are the heart. And we know that you would probably not be here if you thought that families and communities were able to consistently access high quality, culturally relevant, and humble care that keeps them safe and enables them to thrive. Unfortunately, we know that's not the case. And we know, as Paula mentioned earlier, that BIPOC families and communities are most impacted. But we aren't without hope. This program that we'll see on really soon on the next slide was created to offer folks like yourself more opportunities to make a difference in these outcomes in your communities. Both of our programs, maternal-child health systems, as well as our clinical midwifery program, are centered around social justice. You see here one of our graduates who was featured on Public Health Live. She works in a federally qualified health center running an incredible MCH program in the Bronx. So many examples of both clinical leadership in the Masters of Science in Midwifery, as well as advocacy, research, scholarship, and leadership from our graduates. The Maternal-Child Health Systems Master's Degree Program was developed from the ground up with a social justice focus. I often say that many of our students come to us with so much lived experience that they deserve a master's degree many times before they even start our program for all of the amazing work that they have done in their communities working towards health equity. But importantly, they all report along the way that they also got to learn about how to increase their impact as advocates, as leaders, all the while learning how to conduct research, develop effective programs, and impact systems change. That was two more of our graduates there featured. As I mentioned, you will see photos of our graduates peppered throughout the slides because they really tell the story of why our program exists. Here you can see one of our faculty as well in both programs, as well as one of our graduates, Erica Freeman. She runs an amazing podcast, perhaps you've encountered, called Sisters in Loss. And here she was meeting former Vice President Kamala Harris during a summit at the White House. This gives an example, of course, of how you can make a difference as well. Here, you see Faisa Farole, another one of our graduates. She runs the first Black-owned birth center here in Washington State, as well as an incredible program called Global Perinatal Services. She was just talking with our students last week and discussing how they now have so many community-based doulas who speak so many languages that they might turn their program into a national opportunity to have really culturally relevant translators who understand birth available to people all across the country, as well as that in-person doula care and midwifery care that they offer. So just really incredible what folks are doing to improve health in their communities and at large. Here is one of my favorite things, as I mentioned earlier. Really, you get to develop your voice as an advocate, really learn how to make change at that policy level. Here is a picture of me with a bunch of our students. We go every year to Midwife Lobby Day here in Olympia, but also in this program, our students are encouraged to do that advocacy as well through one of our courses, really thinking about how to make those big changes that you want to see from that level. All right. Oh. This is a little bit more about the details, the nuts and bolts. It's really a fast, intense year. You get to know each other in person for 3 days, meet some of your faculty, and kind of, solidify some relationships there, and then spend the rest of the year online until we come back together for 3 days again at the end for graduation. It is possible to do it part-time, but most folks do it full-time in that 1 year, starting in July, ending in June. It's incredible because any of you who are involved with birth know that you can do anything for a short period of time. We are capable of that. And so it's intense, but in a way it's great because you don't have that part of a longer program where you think, oh, this is the hard middle. We don't have a hard middle. We just go and then it's done. But you get to learn so much along the way. So I think that's the main thing to say for that. How do you figure out if this is the right program for you? The type of folks who have come to be part of our program is kind of amazing. When we developed the program, we thought it would be midwives who were ready for a next phase of their career, and we definitely have that. Folks who want to move into public health. One of our graduates down in California, I always want to quote her because, whenever I talk to her, she says something amazing. Like, I loved serving families as a midwife, but I always wanted to impact change for more people. And now that she's part of California Public Health, she says, I'm sitting at those tables where the decisions get made, where the money gets distributed. And so that's really exciting because it's why she wanted to do this and why some of our other graduates do as well. And that's true for folks who are in public health, but maybe don't have the letters after their name to be able to keep, making change and moving up in public health. As well, we have some social workers who have come through. We have lots of doulas and lactation educators who really would just want to take their career to the next level. So those are some examples. But really you get to have that laser focus as well and really love the content of every class. So I think that's the difference between a larger public health program where you get to learn also about, other broader health issues like, addiction and substance use disorder, things like that. We really have a laser focus, right, on the perinatal period and the, so prenatal, postpartum, infancy focus. And you also can have your own sort of pet focus, if something interests you a lot in that sphere. But it's pretty exciting, I think, to be able to have every class be so interesting. And, these are our core competencies you can see here. So giving you a sense of by the end of the program, our graduates leave competent in these areas. You get to achieve those competencies through the program. The curriculum itself really kind of has these threads through them. So we think about our independent project goes through the whole year. That's one big project that you get to develop. And we also focus on, kind of some of those nuts and bolts if you do have to manage other people, if you are going to run a nonprofit, right? We think about how do you get your voice heard, make change, as we said, with regard to advocacy and communication. We think about the whole system and how to do what we call systems thinking, but also make change in those systems, as well as really gaining competency in research and how to do that if you want to, because it is an important aspect of being able to impact change, as well, being sure that we're thinking about power and privilege. So some of this, for our graduates looks like publications. These are examples of books that we read in the program. So, I think it gives you, a colorful view of the kind of topics that we are thinking about in those classes. Some of the class names are sort of not that exciting sounding. So that's why I wanted to put the pretty pictures of the books that, that we also encounter in some of our courses. Here's the not so exciting named courses. And what that really looks like in the real world, those, kind of 4 courses per term that you take. And that summer quarter is a little bit shorter, 8 weeks, but we have those 4 quarters that you kind of scooch right through to be able to learn so much and get graduated. So, is this the right program for you, right? Why might it be? And, like any program, pretty much, of course, it does cost something. The one thing that's, I think, interested me when I was in your seat was that, other programs that are longer end up costing more because you've got to pay for more credits to do a 2 or 3 year program. So if you know that maternal child health systems, that perinatal and postpartum health systems is your passion, this program is sort of laser focused in a way that actually ends up costing less too, which is helpful as well. I think we can go back, actually. That was just bullet point number 1. And, as we mentioned, if we really do want to be these change agents, causing this transformative change, we have to be at the table. What's the saying, right? If we're not at the table, we'll be on the menu. So we really want to get those seats at the table to be able to make that change happen. And sometimes, as Paula mentioned, those letters can help us to get there. And, this program is extremely flexible. So while we are so excited to see your face for a couple days in the beginning and get to know you a little bit in real time, it's really otherwise online in your community, super flexible. The only times that we have folks block out are 90 minutes on Tuesdays and Wednesdays during the weeks of the term for our virtual classes together. And if you need to miss for births, we have ways of dealing with that, of course. These are just some bullet points of real things that folks do with this degree. Probably one of the most common questions, if not from you, it will be from your families. What are you going to do with this degree? And so we have so many folks doing amazing things. Folks running nonprofit organizations of their own, going to work for other nonprofit organizations. One of our graduates is currently working for, a Congress member, working on his MCH policy, but also, writing grants and interacting with consumers on his behalf, and constituents, I think is actually the word in that case. We have folks who work in high risk hospitals, doing that lactation work, but maybe they're able to move to a different level as well because of the education. We've got someone totally in charge of midwifery education in the country of Liberia. Folks are clinical directors. I'm a professor here, right? So is Maya, right? So we really have folks kind of all in all kinds of places. I just heard recently someone mentioning this amazing change in California, and I recognize that it's two of our graduates in the public health workforce in California who are involved in bringing that change to the state of California. So just really exciting things across the board, including research, maternal mortality review work, paid work. There's volunteer work out there as well for that important work. So just some examples.
All right. Thank you so much, Kristen and Heather and Paula and Maya. I love watching you guys talk about this. It's clear that you guys are so passionate about what you do. Um, and so love having you as part of the team and the incoming students are lucky to have you. So thank you for presenting and sharing your passion. I want to transition a little bit to the application process. I do see that there is a question in the chat, which I feel like this might be a good time just for at least this question. Then if other questions come up, we can also save time at the end there. But I saw a question that said, what are the major differences between the midwifery leadership track and MCHS? And is there a way to do both simultaneously as part of a dual degree, or do you do them consecutively?
I can answer since I teach in both programs and did both programs. Our midwifery program is actually unique because it also contains a lot of these elements. So that's really what makes it a master's degree as opposed to just not just, but a bachelor's degree, which is also appropriate for entry-level midwives to achieve. And so really we have this whole track, this whole professional issues track where you also get to do the policy work, learn about research and epidemiology. And so it's not quite as much as we do in the maternal child health systems program, but it's almost. And so you really do get all that leadership work as well, and learning in that regard. And you also right now have the option of a master's project as well, if a project in your community is something you're really interested in doing. So perhaps that helps. But for folks who want to be a clinician, who want to be at the bedside doing midwifery, who want to learn, who want to attend, 100 births and 50 pap smears and all those things, right? The 3-year clinical program is the one for you.
Yes, and they are not dual. There is no dual track currently. They are separate.
Thank you. So let's dive into the application process, the admissions process. Now that you're excited to join Bastyr and you've heard all the wonderful things about these two programs, let's talk about how to get accepted and begin. So I'm assuming you've probably been to our website. If you haven't, bastyr.edu is a great place to start. You can find more information about these programs, the curriculums, anything I talk about here, prerequisites, admissions requirements. You can, of course, find it there on the website. And that's where you're going to find our application too. There's a nice big link in the top right-hand corner of our website to submit an application. We don't require any GREs, no test scores, anything like that. If you have a bachelor's degree, that is the smoothest transition, provided you have satisfied the prerequisites as well. But you don't have to have a bachelor's degree. There is an entryway. If you don't yet have a bachelor's degree, we can just do a Gen Ed course evaluation of your academic history. We do require all of your previous college transcripts, so no high school, that's in the past. We just want all of your college coursework. You can start with unofficial copies. We'll do an evaluation of those, but before you start the program, you do have to have official copies from each of the universities that you have attended. We've made it really simple. Those former universities can email your official transcripts directly to us at appstat@bastyr.edu, or they can do the snail mail, the traditional route. That's how I sent my transcripts. So we'll do an evaluation of that. We'll get back to you. One of our advisors will get back to you and give you the results of that and give you the next steps. When you do submit an application, you get login credentials to an applicant portal where we're going to ask for a few more things on top of your transcripts, like a personal statement, like why do you feel like this program is right for you? What has led you down this path to pursue this education and eventual career? And just it's a get to know you. What can you tell us about you that you'd like to share with us? As a thank you for attending this webinar, we are going to waive the $75 application fee up until November 30th. So if you're interested and you want to apply and you apply within the next 2 weeks, we'll waive that application fee of $75. Each program has its own admissions requirements. So I'll start with MCHS. So MCHS does require a bachelor's degree with a minimum GPA of 3.0, with prerequisite grades of C or better. The non-bachelor's option has 90 gen ed requirements, and 2 full years working as a doula, midwife, childbirth educator. So you do have to have that experience under your belt before coming in, being accepted to MCHS. That program does start in the summer, July 6th. We're still kind of tinkering with the exact start date, but right now it's July 6th. And then the midwifery program is a fall start program that starts in September with a bachelor's degree of cumulative GPA of 2.75. Again, science prerequisites, C or better. Same option, the non-bachelor's entryway, and additional certifications for doula training or DONA or the 2 labor birthing certificates. So once you have your application submitted and all of your transcripts, you may want to apply for financial aid. You'll do that through FAFSA. We have an in-house financial aid department as well. So there is a separate financial aid application internally. We have a $200 deposit to hold your spot once you get accepted, but that gets applied towards the tuition. It's deducted from tuition. So you don't lose that. It just reserves your seat in the program and affirms your commitment. And then we issue your student account, and then we'll communicate with you through that Bastyr email account. We'll send you your enrollment agreement, all the pertinent admissions documents, and anything moving forward academic related. We'll use that email address. And then if you haven't already submitted your official transcripts by the start of the program, we just want to make sure you do that. Every school has their own FAFSA school code. Ours you see right here, 016059. If you put that on the FAFSA, they'll send your ICER, which is your student information, directly to us, and we can begin that evaluation process right away. And the sooner you get it in, the quicker we can tell you how much you qualify for. We have a great team, Nancy and Chris, supporting our financial aid students. You can reach them at finaid@bastyr.edu. You'll see that here on the next slide. So this is Nancy's direct email address, or as I mentioned, finaid@bastyr.edu. I know some things are changing with financial aid beginning July 1st of next year. So if you have concerns, questions regarding that, do reach out to this team. They are well versed in all the new requirements and loan caps. So I recommend reaching out to them. As Carrie mentioned at the very beginning, do come on a tour, check out our campus. We have a beautiful campus in St. Edward's State Park. I am based in San Diego, and I've been to that campus 3 times now, and I'm in awe every time I go there. It has beautiful gardens, it's a beautiful setting. So when you are on campus, you're really going to enjoy your time there, even if you're not there very often, given the nature of these programs. But when you're there, you're going to enjoy it as much as I have. When you're there, visit the bookstore, pick up some swag, some sweaters, some Bastyr swag, represent us out in the community. Or you can visit us and connect with us on socials too. We're all over the social media platforms. So look for us there, connect with us. You get information about updates, campus events, and so forth. So that is the nuts and bolts of the admissions process. It's pretty straightforward. We would love to get started with you. So if you haven't already submitted an application, I'd encourage you to do so as soon as possible. As I mentioned, we'll waive that fee for you up until November 30th. And this is our contact information. It's Maya, Kristen, Carrie, or you can reach out to me directly. Again, my name is Mark Thompson. There is another question there I see. Can you apply before completing the prerequisite courses? Absolutely. You can apply anytime. We'll take your application. We'll start working with you. We'll help guide you on that plan to complete those prerequisites. We have a couple of online learning platforms, one called Portage, Straighterline. We accept those courses that they offer there. And then we can also steer you in the right direction if you need to complete any of the certificates, doula requirements. We can help guide you and show you which classes you need to sign up for. But yes, so you can apply at any time. And then as long as you have a plan to complete all of your prerequisites before the start date, we can even do a conditional acceptance as well. That was an easy one. I like taking easy questions. So I'll give it another minute or so if there are any other lingering questions or if any of the panelists would like to add anything additional before we sign off here.
I did see one of the previous questions was about clinical location. Clinical rotation. Many people are not living close to campus and come in to do their on-site time. Whether you're close to campus or not, you have to be off call on your on-site time, so that because of our hybrid program, it's really mandatory that you're here to attend the clinical classes and the didactic classes in person so that you can really get those skills and those exams and that learning done. So even if you live on campus and you are part of a clinic and a site where you're attending births, you are required to be off call during those times of on-site so that you don't risk missing your classes.
And I can share that it's kind of amazing the places folks have come from. We had one student, she hated flying, but she lived in Alabama and she would drive to on-site from Alabama. That is clearly the most, far. She gets the award for the farthest. Of course, most people are closer than that. I had rotations in Portland, like where Heather lives. She comes up to teach from there. We have rotations in the middle of Washington State. I worked in the north of Washington State, right? So but there's even, now we have a student coming from Maryland, right? And so we've had Ohio, probably if you name it, we've had someone sometime over the decades. So it is doable, but it's a lot, but it's also special because you get to actually have both, have your cake and eat it too. That's what I think.
And we do have clinical sites right now in several states. And we're always looking to add more. If people can meet the requirements, then we're happy to talk to them about becoming preceptors. So.
And one of the things I'd like to say about completing your doula and childbirth educator training course is that you can do that here on Kenmore campus. We have the Simpkins Center, and they're wonderful. I can get you in touch with them. I've sat in on a couple of the classes with the teachers, and they're wonderful. They do have some online classes as well. So if you're not nearby and it's a trip, it'd be too far for you to travel, do check us out and see if there's some online classes you can take for the midwifery training. Yeah, it's a great way to start connecting. So love to pitch that part.
Thanks, Carrie.
Yeah.
There's a question about housing. Kenmore campus does have on-campus housing. Could somebody talk about if midwifery or MCHS students are eligible for that, given the short time frame that they're on campus?
Yeah, I can take that. MCHS students are only on campus at the very, 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 very beginning and at the very end. And so there isn't any official housing per se associated with that program. However, with the midwifery program, we have a student village, and we do have what students do is they end up renting one of the rooms in the village for the week that they are attending, again, what we call on-site, or when you're in person for further instruction and hands-on clinical skills and things like that. And we have Dean Wider, Susan Wider is ready and standing by to help folks with their housing in campus, on campus, as well as resources outside of campus as well.
Thanks, Paula. Housing at Bastyr.edu. That's an easy one. Housing at
There we go.
Bastyr.edu.
Yeah.
And if that doesn't work out, I'm sure Paula has a futon that you can crash on.
Oh, yeah.
All right. Well, that wraps up all the questions. I know we were very thorough, give you a lot of information, a lot to digest. So following this, what we'll do is we have everyone who's attended, we have your contact information. We'll email you a follow-up following this webinar with a copy of the recording. So you can rewatch this as many times as you like. But like I said, you can also go to our website. There's a lot of information there. Peruse the catalog, the requirements, the curriculum. And then if you have additional questions, every one of these panelists, including myself, is willing and able to help you get the questions answered that you need and help you along this journey. The hardest part is taking the first step. And so we have a great team here, top to bottom, of folks who want to help you, want to see you succeed in this journey through graduation. So thank you so much for attending, everyone. Thank you to the panelists. Thank you, attendees, for being here. I look forward to talking to you soon and welcoming you to Bastyr. Bye.
Thanks, everyone. Bye-bye.
Thank you.